Welcome, everybody. This is our second media briefing for Council President Tom Hucker and Council Vice President Gabe Albornoz. Reporters who are on the line who have questions, please feel free to put your question in the chat and we will answer them in line. I'm going to turn it over now to Council President Tom Hucker for some opening remarks.
Good afternoon, everybody. Thank you, Susan. Thanks to everyone for coming. I'll begin with a few comments about Governor Hogan's announcement this morning on a Maryland Relief Act, on the election certification and some upcoming council matters. And then I'll pass it over to Dr. James Bridgers, our Deputy Health Officer who's joined us, as well as to Council Vice President Gabe Albornoz, who can talk about some matters before his committee and the HHS committee. And then we'll see what questions you have. Yesterday, I organized efforts to call on Governor Hogan to release emergency relief from the state's rainy day fund and from the FY21 state surplus. This followed a call I had organized before the holidays. Once we found out that Mitch McConnell had stripped local aid from the bipartisan relief package that passed through Congress, we organized a call on the governor to release the state's rainy day fund and the FY21 surplus. We were joined at that time by Senator Cardin, Treasurer Kopp, Comptroller Francho, and many of my council president counterparts from many of the largest counties in the state, as well as many rural counties as well. Yesterday, was joined by the county executive and Senator Van Hollen, Comptroller Francho, Congressman Brown, and many elected leaders and small business owners and leaders and civic leaders from around the state, as well as the elected presidents of the NAACP and a number of other statewide organizations. Representatives actually came together yesterday from all 24 counties in Maryland to call on the governor to release the rainy day funds and the surplus. Over 6,800 people have signed a petition that you can find at mdreliefnow.com, which people continued to sign throughout the rally yesterday. And less than 20 minutes after the virtual rally ended yesterday, Governor Hogan announced that he would be holding a press conference this morning to provide his announcement on an economic stimulus plan, the type of which we have been asking for. Today, he announced the Relief Act of 2021, which includes some funding for financial relief as well as tax cuts for working families and small businesses and unemployed Marylanders. You, I'm sure, have a lot of details about that with you. I'm glad that the governor has heard our calls for urgent action. While this relief package will provide some assistance to our most vulnerable residents, much more is needed. The governor's proposal is a step in the right direction. I'm glad that he's responding to the thousands of Marylanders who have called on him to take action from every jurisdiction in the state. However, the governor's proposed plan does not provide any immediate relief to families and small businesses. Instead, it passes the responsibility to the legislature, which slows down the process. 2/3 of the Board of Public Works, the comptroller and the treasurer, the chief investment officer of the state and the chief financial officer of the state, have called on the governor to issue immediately a Maryland stimulus and allow the comptroller to issue checks to the most vulnerable Marylanders that are suffering every day during this pandemic and historic recession, and provide some relief to small businesses as well. The governor's package doesn't have any of that in there. The relief package, unfortunately, while it's a step in the right direction, is insufficient. There's no reason in the richest state, in the richest nation, in the history of the world, that we should have families lined up for miles to get emergency food relief in every county in the state, and 250,000 families facing eviction. Governor Hogan also, unfortunately, with his package, combines two policy pathways. Instead of immediately allowing the BPW to issue the stimulus checks to people using FY21 money, he has a legislative package that will affect the FY22 budget moving forward. The question remains what to do with the $1 billion in the rainy day fund and the surplus that's in the FY21 budget that should be used right now by the executive branch headed by the governor to provide that relief. His package included $100 million of the $1 billion that's in the rainy day fund, which is obviously a real pittance when you're dealing with the most severe economic crisis since the Great Depression. So glad he is listening. Unfortunately, his package is insufficient. We look forward to working closely with him and legislative leaders to improve upon the package. In terms of election certification, democracy prevailed this week in the face of lawless insurrection as Congress certified President-elect Joe Biden and Vice President-elect Kamala Harris's victory. We're extremely proud and grateful for our congressional leaders who honored their commitments to the American people by preserving and protecting and defending the U.S. Constitution in the midst of the chaos and insurrection of last week. We're also thankful to our law enforcement and fire and rescue personnel who participated in the response at the Capitol to help restore orderly and peaceful transition in government. The Council looks forward to beginning a new chapter in our nation's history on January 20th, which will be focused on healing and renewal and the common good. Let me also share a few updates of some matters before the Council before moving to Dr. Bridgers and the vaccine rollout. I'll be holding a press conference on Wednesday the 13th at 10:30 a.m. on the window guard bill that has been introduced in front of the Council tomorrow. The bill comes in response to several incidents of young children enduring serious injuries and even deaths from window falls in Montgomery County. I introduced the bill in December, 2 months after the most recent incident in which a 2-year-old boy tragically died after falling from an apartment window in Tacoma Park. I'll be joined by speakers from Children's Hospital, from CASA and the Renters Alliance, and other community advocates who will share their personal testimonies and support for the bill. And you can contact my office for registration for that press conference on Wednesday. I want to mention the Streets and Parks renaming effort. As part of the Council's ongoing work on racial equity and social justice in our community in June, we requested a comprehensive review of all county-owned and maintained street names and public facilities to determine all those that have been named for Confederate soldiers or those who did not reflect Montgomery County values. And on Tuesday afternoon, the planning board members and park and planning staff will brief the Council and delineate next steps in the process for renaming public places and streets. There are, to my surprise, more than 950 street names matching the surnames of a Confederate or a Montgomery County slave owner. There are approximately 140 place names within the county matching a Confederate or slaveholder surname. This comes at the response of many resident complaints over the years and is an opportunity to rename streets and public places based on the values that are important to Montgomery County residents today and also reflect the diversity and the values of our community. I wanted to mention the Shady Grove Minor Master Plan. On Tuesday, we'll continue our commitment to smart growth principles and generation of additional housing options by introducing the Shady Grove Minor Master Plan, which focuses on land use, zoning, and zoning recommendations, primarily surrounding the Shady Grove Metro Station. The Shady Grove Minor Master Plan is scheduled for public hearing on February 2nd at 1:30 p.m., and we'll have more details if you're interested. I also partnered with Councilmember Reamer on a new bill that will improve the quality of life and the business activity in downtown Silver Spring by creating a Silver Spring Business Improvement District. This measure will provide enhanced public services and facilities and generate public activities to benefit businesses and residents in Silver Spring and provide improved streetscape and public property maintenance. We've received a petition signed by a majority of property owners in Silver Spring, which triggers a requirement for a public hearing. So this bill is responsive to that action from the public. We wish to hear from everybody and to evaluate and to enhance a structure that may serve the needs of the business community and the community at large in Silver Spring. And I'll turn it to my colleagues on vaccine information, but first I'll just say across the nation, obviously local leaders are responsible for deploying COVID-19 vaccinations on their own because there's no defined implementation plan from the federal government. And vaccine distribution is occurring on a rolling basis across all 50 states. We're excited about the effectiveness and the safety of the Pfizer and Moderna vaccines. There's a tremendous urgency to get those vaccines in as many arms as possible, as quickly as possible. This is essential to protecting the health and welfare of all our residents as positivity rates continue to rise across Maryland and in our community. However, we're limited by the number of vaccinations we're provided each week by the state of Maryland. We're grateful for the rapid rate in which our Department of Health and Human Services has deployed the vaccinations provided to Montgomery County by the state. Governor Hogan actually recognized Montgomery County as one of only 5 counties in the state who have already used 80% or more of the COVID-19 vaccinations provided by the state. Other counties included Caroline, Calvert, St. Mary's, and Howard. Maryland is currently vaccinating healthcare workers, nursing home staff and residents, first responders, and public safety personnel in phase 1A of the vaccine distribution. I'll turn it over now to Deputy Health Officer James Bridgers, who can elaborate on this and has many additional points. Thank you.
Good afternoon, all, and thank you, Council President Hucker, for allowing me to briefly speak and provide a update on where we are with our vaccination rollout. As you indicated, we are challenged somewhat by the amount of doses that we receive on a weekly basis from the state, but we have worked very diligently to put those shots in folks' arms. Just to crosswalk and back up a bit to date, our accounting record that we have is that we received 12,900 doses to date. By Friday close of business, we had administered 8,939 of those doses, which is about 69%. Today, we are projected to be up to 83.6%, and tomorrow we will have maxed out 100% of all of the available doses that we've received to date. Keep in mind that we receive notification typically over the weekend about the amount of doses that we will receive the following week. We haven't received our doses this week, and we expect to receive them tomorrow, but we still move at a very diligent pace of about 1,500 to 2,000 doses a day. We've also have progressively moved through our 1A category, and we are vaccinating now our public safety responders, and we have support from our fire and rescue to help our municipalities and our county police officers, our EMS, our fire and rescue, our 911 dispatchers, and we have about 1,000 doses per day. That's 3,000 doses of the allotted 6,700 doses that we are expected to receive today. And so that's a huge lift as we continue to vaccinate folks under our priority grouping of 1A, and as we continue to revise our plan based on the amount of doses that we have moving into 1B, which includes our senior populations. And we aren't there yet, but we are planning for that phase of our vaccination process. Going back to our vaccination rollout, we've had conversations with Kaiser to provide support to our healthcare professionals and dentists and morticians and other entities under our 1B prioritization and grouping. We've had conversations with our hospitals to support our efforts so that we can get more folks vaccinated. But again, the key variable is the amount of vaccines that we have readily available so that individuals who go into our system and schedule appointments are able to actually have those appointments fulfilled. On a daily basis, we have a set amount of vaccines that we have allocated for our current testing spaces in Up County Recreation Center and White Oak Recreation Center this week. And then we've added, through a partnership with our Montgomery County Public School System, Quince Orchard High School to do testing as well. So those are the current spaces that we have, including the conversations that we've had with our hospital partners. And we've had conversations with FDA to support a vaccination plan where we would vaccinate some of their clinical staff, as well as have the capability to add yet another provider to support our vaccination plan. So we continue to work diligently. Progressively, we've tested more folks than I think vaccinated more folks out of the counties who have presented. And the data that you may see or you may receive is behind today. So you may see a lower percentage of our vaccination strategy, but at the end of the day, we still have a significantly high number of vaccines being put out in the community and individuals actually getting shots in their arms. So that's pretty much the update where we are today, and I will stop there subject to any questions. And again, Council President Hucker and Vice President Albornoz, thank you for the opportunity to provide that update.
Thank you so much, Dr. Bridgers. I really appreciate all your leadership through this, and Dr. Gales as well. Let me throw it to the Vice President of the Council.
Well, thank you, Mr. President. And I just want to take a point of privilege to thank all the members of the media that covered in real time the insurrection that occurred on the Capitol last week and put yourselves in harm's way to make sure that we tell the story accurately of what occurred that day. It has obviously been such a difficult year and time in the history of our country. And I also want to express my gratitude to the Montgomery County officers that joined the police officers from across the region in helping to keep our community and our country safe. Later this month, I want to thank the council president who has been working with me on receiving an upcoming briefing. This has not yet been scheduled, but will be in the very near future regarding nursing homes. There was some excellent reporting done recently on nursing homes and their response to the pandemic, and some things that have been occurring within that industry that I think do bear a discussion. And so we are working with representatives from the state and our local Department of Health and Human Services to receive a briefing on those issues. The Health and Human Services Committee will also be working with our Education and Culture Committee to continue an ongoing discussion regarding the mental health programs and services that we offer here in Montgomery County. All of us are tremendously concerned regarding the mental health toll that the pandemic has placed on all of us. And we will be having a discussion specifically to talk about the diversity in our county's mental health workforce, because we have to meet community residents where they are. And we're hoping that that session will lead to additional concrete recommendations and potentially has budget implications. We are also going to be discussing jointly our education equity hubs, which have been a tremendous success in providing some reprieve for families who have otherwise not been able to afford additional support for their children as they study at home. And so that will be another discussion that we have later this month. I defer now back to you, Mr. Council President, and look forward to answering any questions that you, the members of the media, may have. Thanks a lot.
Thank you so much, Councilmember Albornoz. Okay, Susan, I think you're moderating the questions.
Yes, I am. The first question we have today is for the council president from Rebecca Tan from the Washington Post.
Hi, Rebecca.
Hi, can you hear me?
Yeah.
Great. So question for both Council President Tom Hucker and Council VP Gabe Albornoz. I'm wondering if you can just say whether you're satisfied or have any concerns with the rate of vaccination so far, both in terms of the county's distribution, but as well as at our hospitals, as well as nursing homes. Maryland as a state doesn't seem to be doing so well, so I'm curious to know what you think.
I'm satisfied with the council's rate of vaccinations. As I mentioned, we were recognized by the governor, and subsequent to that time when he recognized us, our adoption rate actually increased. But as I mentioned, we're very much at the mercy of the state as far as how many vaccines we get and how much notice we get. So we would greatly benefit from more predictability, more transparency, and a longer-term plan. I'll let Dr. Bridgers and Council Vice President elaborate, but we often find out on Saturday what number of vaccines we're going to get on Tuesday. And that's very hard then to make plans to have an adequate number of sites available and vaccinators available and everything else. So Dr. Bridgers?
Thank you, Council President Hucker. That is correct. We are planning as we go, if you will. We have a plan that we presented to the Maryland Department of Health, and to progressively move through those phases would require us to have an operating level of vaccines. Just to give you a snapshot, we originally received 4,300 vaccines. The next dose was 8,600 vaccines, and this week we are scheduled to receive 6,700 vaccines. And so as we send out our notification and our information, we are progressively moving through phase 1A, but in order to move to other phases or other tiers, which have a set level of prioritization, we need the doses. We need the doses to be able to have that planning process in place so that we can project out the amount of vaccines that are required for any one particular site. Our fire and rescue has calculated just this week alone that in order to vaccinate a significant or a good number of fire and rescue, to include public safety officers, they would need 3,000 vaccines this week. That is a little less than half of what we have this week for our vaccination clinics. I know that Dr. Gales has inquired about the lower amount, and I haven't received any additional update, but that's pretty much part of our planning process is built around the amount of vaccines we receive on a daily basis, on a weekly basis, I should say. One other point to that is that working with our county communications team and other providing information graphics and our webmasters, we have created a website where individuals can go and they can get up-to-date information about where they would fall categorically in those phases. It's a very multilingual website that has information that individuals could sign up and request an email or text to see exactly where they fall within the phased approach so that they can get an indication and how to plan to either get to a vaccination site or when their number is called.
And if I can just quick follow up, I'm sorry, Dr. Burgess, can you talk about the pace of vaccine distribution at nursing homes as well as hospitals? Is it in Montgomery County, is vaccination at those locations going according to plan, or do they need to be quicker?
Great question, Rebecca. We don't manage the vaccine distribution to our assisted living facilities, our developmental disability agencies, our rest and rehab centers, and our local hospitals. That's managed by the partnership on the congregate living spaces with CVS and Walgreens, and with the hospitals with the state. And so they actually received the Pfizer vaccine a week prior to us receiving our Moderna vaccines. And so we've managed what we had in an incredible manner, and we don't have any management or oversight in the doses that they receive.
So I would just add really quickly, Rebecca, that I certainly associate myself with everything that Dr. Bridgers and the council president has said. I think the county is doing the best that it can to control what it can control. But there is so much out of our control, from the lack of a coordinated federal response on vaccine distribution to the differing approaches and policies from state to state and the ones that have been incurred by our state here in Maryland. We are doing a remarkably good job, especially compared to other jurisdictions, of getting the vaccine into people's arms within a reasonable time frame once we receive those vaccines. But clearly, we need more of them more quickly, and clearly, we need to do a better job of ensuring accountability and that we are more effective in disseminating them to our most at-risk populations, including our nursing homes, including our group homes. So there is clearly more that needs to be done there, but the county is pushing every button that it can at the moment.
Thank you.
Okay, our next question comes from Carla Flores from Telemundo, and they are to the Council Vice President, and she'd like to answer it in Spanish, please.
Hi, can you guys hear me? Sorry, I'm in a little bit of a...
We can hear you.
Okay, perfect. So, señor Albornoz, buenas tardes. Quería hacerle la pregunta, básicamente la acaba de responder en inglés, pero es básicamente cómo se siente con los esfuerzos del condado, qué es lo que se necesita para acelerar el proceso de vacunación en estos momentos y qué es lo que se avecina pronto en términos de la siguiente fase de la vacunación en el condado.
Bueno, gracias por esa pregunta. Creo que el condado está haciendo todo lo que puede hacer para controlar lo que podemos controlar. Pero desgraciadamente hay mucho que no podemos controlar. No podemos controlar el número de vacunas que estamos recibiendo del Estado. También no podemos controlar la estrategia que está usando el gobierno federal para mandar las vacunas a los estados. Nosotros sabemos que necesitamos muchos más vacunas y los necesitamos más rápido. Pero sí estamos trabajando junto con el Estado para hacer todo lo posible para controlar lo que podemos controlar.
Y la segunda parte es acerca de lo que se avecina en términos de la vacunación. ¿En qué fase estamos en términos de la distribución de las vacunas?
Todavía estamos en el primer fase donde estamos dando la vacuna a toda la gente dentro de nuestro sistema médico que está trabajando con la comunidad. Luego vamos a pasar al segundo paso, donde vamos a ayudar a más gente y también personas de tercera edad.
Ok, perfecto, gracias.
Gracias.
Thank you, Carla. The next question is from Suzanne Pollock from NCM. Questions for both the Council President and Vice President.
Hi, thanks a lot. I was wondering if you're satisfied with the rates, if they've gone down with the closing of indoor seating in bars and restaurants. Do you plan to continue that? Have you seen any effect because of that?
Dr. Bridges?
Sure, Council President Hucker. From the data that we had from surveillance, we did see a reduction in restaurant workers as far as the transmission. I haven't received any additional data updates since last week, but there was a slight reduction in those individuals as part of the COVID link and the contact tracing.
You're saying employees at restaurants? Is that correct?
That's correct.
And is there an end date for this, or?
I don't have that information
Okay.
during this press conference.
All right, thank you.
Okay, our next question is from Randy Bass at WDVM.
Good afternoon, everybody. Thanks so much for having me on the briefing. I'll direct this question to Dr. Bridges. What are you hearing about in terms of ramping up production of the vaccine? That's been a hot topic in national and local news. And is that information on ramping up production, is that trickling down to local health departments, and is that informing your decisions going forward?
Great question, Randy. We haven't received any additional information about a ramp up. We continue to plan at a local level for an increase, and on a weekly basis, focus on projections across various prioritization levels within the tiering of those prioritization levels and across the county as well, using lessons learned from our testing piece that we've used to make our testing strategies more targeted. We too are looking at a ramp up in making our vaccination strategies more targeted to increase vaccination in the community. We haven't received anything, and to my knowledge, during this press conference, any information about a ramp, anticipated ramp, or receiving more doses. It is still on a week-to-week basis thus far.
Thank you so much.
Our next question is from, let's see here, Marcela Rodriguez from Univision, to everyone. And she would like to talk to I'm sorry, that's incorrect, to Council Vice President Albornoz, and she would like her questions answered in Spanish, please.
Hello, good afternoon, happy Monday. Buenas tardes, vicepresidente Gabe Albornoz. El día de hoy quiero consultar, ustedes en el condado de Montgomery han hecho un excelente trabajo ayudando a la comunidad latina que se ha visto seriamente impactada por el coronavirus, y esto se ha dado a través de la medida por su salud y bienestar. Con respecto ahora a la vacuna, ¿tienen en mente algún tipo de iniciativa específicamente para los latinos? Ya que sabemos que muchos trabajan en áreas de limpieza o en posiciones vulnerables que los ponen en una categoría de alto riesgo.
Gracias por esa pregunta, Marcela. Primero, el condado está trabajando con la comunidad para mandar el mensaje que la comunidad debe tomar la vacuna cuando hay una oportunidad de tomarlo, porque eso es un mensaje sumamente importante. Estamos trabajando con el Departamento de Salud, el Estado y el gobierno federal para producir más vacunas, y mucho de nuestra comunidad latina son parte de la categoría de gente que van a recibir la vacuna en parte del primer fase y parte del segundo fase, porque nosotros sabemos que hay partes de nuestra comunidad, como hemos visto por la iniciativa por nuestra salud y bienestar, que son más impactados por el virus. Así que nosotros tenemos que dar más vacunas en esas áreas, porque es importante para la comunidad entera.
Muchísimas gracias.
Okay, our next question comes from Brianna Adekusuma from Bethesda Beat for Dr. Bridgers.
Yes, thank you. I just wanted to ask when second doses are expected to begin to be administered, and will the county be reporting the data on how many first doses versus second doses have been administered? And I have one question after that.
Great question, Brianna, and good afternoon. We will receive our second dose of 100 doses this week with the 6,700 doses that we are anticipating or planning to receive this afternoon, tomorrow, whenever it comes. The system, the PrepMod system, will generate notification to those individuals who received the first dose. Right now, our plan is to have those doses mutually exclusive from the initial dose. So as we receive additional doses, 6,700, 4,300, whatever the case may be, we are expecting state to provide us with those initial doses for the individuals who received appointments. So if there were 1,800 appointments for one day, those 1,800 individuals should expect to receive a second dose in addition to or separate from the doses that we receive for that weekly count. So we will be administering those second doses this week for those individuals that received their initial vaccination in the latter part of December.
As a clarification, is the 100 part of the 6,700 or in addition to?
No, it is exclusive, separate from the 6,700 that we received. When the first 100 doses that we received were for healthcare professionals, individuals who were involved in the COVID-19 response to test the PrepMod system. Those individuals will start to receive their second dose sometime this week based on the notification that they received from the PrepMod system to schedule an appointment. So they are different doses.
Okay, thank you.
You're welcome.
And then the second question, I know you mentioned transmission appears to be down among restaurant employees. What is contact tracing data showing regarding restaurant customers?
So I don't have the data before me specifically regarding restaurant customers, but I just want to share this afternoon that the rate of transmission in Montgomery County is still high. The test positivity for today is 7.1. We had 406 positive cases resulted from the data yesterday. And over the weekend, we experienced 639 positive cases, which hasn't been that high since a peak in December, which was around 474, as well as this highest 7-day average. So I don't have the contact tracing data before me, but there's still a high rate of transmission in the community, and we still need to be vigilant. We still need to wash our hands, keep our social distancing, wear our face covers, and continue to check the system, the notification system, our vaccine website for those individuals to see where they would fall in the vaccination phase. I know it's a little more than you asked, but I wanted to give you the snapshot of where we are. So we haven't gotten away from our testing. We tested in 25 spaces last week, still one of the highest levels of testing in the state of Maryland. And we continue to do that vigilantly, but we also are moving towards vaccinating more folks. So those two areas are highly focused right now in public health services.
Great, thank you so much.
Okay, and we have one more question from Carla Flores from Telemundo to Council Vice President Gabe Albornoz.
Hi there. Sí, me olvidé hacerle un follow-up acerca de lo que aprobó el gobernador Hogan. Yo sé que como condado han estado haciendo un llamado para que apruebe más dinero, a que ayude a las familias. Entonces, pues lo que aprobó hoy o lo que anunció hoy, ¿qué significa para el condado? ¿Qué opina de eso?
Bueno, estoy de acuerdo con el presidente del Consejo que esto es un paso sumamente importante del gobernador y le queremos dar la gracia por este paso. Pero desgraciadamente todavía tiene que pasar por el proceso de legislación dentro de Annapolis, así que va a tomar más tiempo para que la comunidad reciba estos fondos. Y nosotros sabemos que la comunidad necesita estos fondos inmediatamente. Así que le queremos dar gracias al gobernador. Esto es un importante paso, pero todavía hay más que hacer para ayudar negocios y gente que están en crisis.
Perfecto, muchas gracias.
Okay, that wraps up our questions from the reporters. Council President Hooker, I'm going to throw it back to you to close it out.
Okay, thank you so much, Susan. Thanks so much to the Council Vice President, to Dr. Bridgers. Really appreciate everyone's availability today, and obviously stay in close touch with us if you have follow-up questions in the future. We'll hopefully see you tomorrow at the council session.
Okay, Tom and Gabe, please stay on the line just for a few minutes.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
Introducing Right on Flex, Montgomery County